Hi, everybody. Want to welcome you guys to our next HLS installment of webinars. Today, we're going to be talking about third-party identity risks in healthcare. And I want to welcome our speakers today. We have Luiz Cieslak, of course, joining us again as our SVP of Healthcare and Life Sciences, and Dustin Fernandes from the Thales team. So, gentlemen, do you want to go ahead and introduce yourselves and queue us up?
Great. Yeah, thank you for having us. Dustin Fernandes here. As mentioned, I help run the enterprise business acceleration team over at Thales, really focusing on identity and third-party identities when it comes to B2B and B2C in the CI&T space. So really looking forward to diving into how we can talk about the the growing causes of pain in the healthcare sector.
Thank you for joining us, Dustin.
Welcome.
Luiz Cieslak, thanks for having us again, Yesenia, on the Healthcare Life Sciences. I'm responsible for our global practice, Healthcare Life Sciences, and excited to talk about a critical topic in the world of healthcare nowadays, especially if looks like every other week we got something in the news about cybersecurity. It'll be an interesting conversation.
Well, thank you both for joining us today. This is, again, a very not even interesting, but important topic, I think, right now. It was definitely a big factor at HIMSS. Like you said, I keep seeing news articles of different organizations being affected by these different attacks and cybersecurity risks. So, Dustin, since you're the expert here, I guess, can you kind of set the stage for us on why there's so many more um, risks that have been coming up lately? What are you noticing in the market, or what's been, occurring to different healthcare organizations most frequently that they should be concerned with?
Yeah, so I would say the biggest problem right now with identities, specifically when you think about the healthcare sector, are third party identities. All of the non-traditional employees that need access to your back end systems, and this could be, you know, medical students, temporary workers, suppliers, vendors, etc. Anybody who's coming in maybe only for a certain period of time. That doesn't go through the normal vetting motion of your traditional employees, and those identities tend to be the target of attacks at a higher level because they are not watched as closely, they are not monitored as closely to make sure when they're coming and going. And so that I would say is the biggest factor that we're seeing right now in terms of what's being targeted in the healthcare sector.
Got it. So it's a lot of third party ecosystem being involved too. So that's where like all these risks have started to come up in healthcare.
Correct, correct. Yeah.
Thank you for that. And Luis, also, you were with me at HIMSS. You joined us, and we kind of talked on some of these points there and on the podcast. But from our clients and from HIMSS, what are CISOs and CIOs most worried about when it comes to extended workforce identities? Like, is that something on their radar? Is that not even, something they're taking into consideration just yet?
No, this is definitely top of mind for a lot of the clients and the conversations we've been having. Cybersecurity went from being like a distant item down the list of priorities for CIOs and board level conversations, and obviously always top priority for CISOs, but is always kind of that neglected, forgotten child. And as over the last, I want to say 18 to 24 months, that became a top priority. Some analysts like Gartner, Forrester have pulled it up, and the some of them are saying it's like one of the top three or one of the top five. So definitely one of the top priorities for hospital systems. I think, especially after what we saw last year with the breach of large hospital systems and large data processor organizations in the US, that became very apparent and very critical for everybody that data, the security, the third party that management that Dustin mentioned is top priority in terms of investments and agenda priorities for them as well.
So an increased reliance on third parties, identity sprawl, like are these identities everywhere, essentially. Then you have manual processes that are, sponsor modern pitfalls, just like anything else. But there's also a difference between risk awareness and readiness. Where do you think most healthcare organizations are currently lying? Are they still kind of, more along the lines of being aware of what's happening, or are they prepared just yet?
Ooh, Dustin, maybe you're closer to this one. I have it, but I wanna. I'll put you on the spot for the
Yeah.
for.
How to throw off curveball in there.
Oh, I know, and that's a great question, and I think there are a lot of hospitals and healthcare systems out there that are aware that this is a growing problem, but they're not ready yet. Right? They're moving in that direction, but in terms of it's kind of is it going to come first? A lot of people don't tend to act until they have a third party data breach, and then at that point, it's too late. And so the awareness when we are out talking to clients, speaking at conferences, we're seeing everyone say, "Yes, this is something we're aware of. We just have to get to it in terms of everything else they're trying to do at the same time." And I think that as we see more and more breaches come about, specifically about from third party identities, more and more of these hospitals and healthcare systems are starting to take this seriously, but they're moving towards readiness, just not there yet.
Thank you for that breakdown.
Just gonna
Sorry, Luiz, go ahead.
points. I was gonna just add to your point, Dustin, of a lot of everybody. I think there's awareness, right? At least on conversations I've heard and that I've participated, but it's everybody. People don't know what they don't know. Like the complexity is increasing. The ecosystem is getting more and more complex. Like more reliance on third party, like multiple processors across the ecosystem, and I think that people might be doing they might be doing like some table tests and validating theoretical, but no, I don't think majority of the hospital systems are looking at the entire chain across the ecosystem to be prepared. So they might be ready, and I heard this expression on a conference last week. It's like the hostels are normally the Fort Knox. It's like everybody is hiding. It's very hard to get in,
Mhm,
but there are entry points, right? You have your third party, you have your service providers, you have other parts that uh,
mhm.
sometimes forget to make sure that your doors, those doors are locked in.
100% agree, Luis. I mean, you think how much, hospitals and healthcare systems vet their employees that need to come through and they take that very seriously, but they're maybe not looking as closely as the medical students that need to come in for a rotation, right? Or maybe one of the vendors that and they're changing out a vendor who supplies them with XYZ for the hospital and they don't know how often that vendor's, delivering a product or coming into the system to come change things. So those those external identities that, again, aren't monitored as closely as or aren't vetted as closely either as their normal employees are the ones where they can really, have the highest impact of a breach.
And what makes I'll say this question to Dustin, actually. What makes third-party identity risk in healthcare different from other sectors?
Right. I would say, healthcare as a whole is one of those sectors where they have almost, the most complete uh, look at your data in terms of your entire data scope. If you look at something, like a retail company for say, and if someone gets into your retail account, they may get your shipping address, your name, maybe your credit card number. But then that's about it. When you start looking at like a healthcare company, they're if someone gets into your account, that's your social security number. That is your credit card. That's your medical information, which is very valuable on the dark web and for blackmail purposes, whether it be to help commit insurance fraud, really looking into using that data to either blackmail you or other people. So in terms of complete data and how you could basically package that data to continue to use for the long term bad actors, it's not as easily to detect as, just a credit card being stolen from a retail account per se, right? They have everything to continue to open up more fraudulent accounts on your behalf because they have such detailed information, continue to do insurance scams and so forth. So I would say all of that data together makes that healthcare sector very valuable and also very hard to track down at the end of the day.
Yeah, and we keep hearing about, like, AI and phishing and impersonation, so is that kind of what you're referring to also? Or is just the access that people are able to, or like what they're able to attain from your information, essentially.
Right. So I would say it's part of it. It's what they're able to obtain from your data, but in terms of AI and phishing and impersonation, how that's currently where the attacks are currently coming from to get into your data, right? That's where they're either injection attacks or presentation attacks for your camera feed, right? Either impersonating who you are, the video feed, and a lot of companies or a lot of organizations, healthcare organizations, aren't ready to do liveness detection, aren't ready to really check to see where that data feed is coming from and validating that data feed. So that's where I think the AI and phishing is coming into play now. It's not it's not mainly they're not using that healthcare data to supplement, and they could, but really where we're seeing AI attacks right now is to get into those third party identity accounts and really impersonating that person, that healthcare worker, supplier, vendor, whoever it may be, to get into their account and kind of go past the very basic multi-factor authentications that these companies have in place.
Even the social engineering too, right? You have a
Correct. So,
super complete data set when you talk about healthcare breach. Like you talk about,
mhm.
it's like the security number, date of birth, name, like addresses, history of medication. You have, in many cases, like credit card payment because you
Right.
process your visit payment there. So you have it's in one set in one data set. I think you're able to get a lot more than some of the retailers that you mentioned. I came across this statistic the other day that I thought was fascinating. As healthcare data breach are more than twice as costly as the global average. So, on average, a data breach costs about $4.4 million. The healthcare ones are about 10.9 million, just because of the
Wow.
trove of the quality quality of data, for lack of a better
Right.
description, right?
Right.
Crazy. So
Yeah.
it's very, very worthwhile people going in and finding the weaknesses in those points.
Mhm.
And these are crazy, you don't even think about some of them. I think we've already come so far, but, I think one of the favorite quotes I've heard is like, "Hey, you lock your doors at night, right? Do you check your windows and make sure your sliding doors and everything else is locked also? Because if you're not doing all those things, it's almost like all these organizations kind of leave themselves open for attacks. So you're not gonna get into the door, we can get into the window." Like, these attackers will apparently not give up, they're relentless, really. So, what is the best way to kind of approach all of this? Like, um Luiz or Dustin, what are some safety practices and also the consequences of like not being aware of these different risks and what could come from having these gaps in security?
To begin with, is looking at holistically at the entire process. And we're saying the healthcare data, the healthcare breach. When we take one step further, I think we touched on a few different nuances, but let's look at the overall ecosystem nowadays. The data flow is a lot more complex than what we imagine, right? You go like as a patient, right? You interact with the doctor's office, or you went to the hospital and you saw a doctor there. You think your data is there in the hostel, but in reality, yes, your doctor, you went there, you had that interaction with the hostel, with the clinic, but your data then gets submitted to a third party data processor in most cases, where they're going to be doing the billing back to your insurance. The insurance might actually have a subdivision that will then do its own processing and claiming to see what are the availabilities. In many cases, those all like that is one step below. You go one step below either. Like each one of those steps might have different third parties that are involved. So you might have a small subset of vendors, or just a staffing agency that comes in and talks and does the billing and does the coding so that the bill gets submitted correctly. And that's not even talking what Dustin mentioned at the beginning, where you have medical students, you have traveling nurses, temporary doctors.
Mhm.
So when you start seeing all of these different aspects and the different points, it's like you see so many points of failure, like the your analogy of the door and the window is great. Like, you check out there. It's like, are you checking, making sure that you don't trust? Are you starting from the principle that you don't trust anybody? So, are you getting the security right? Are your controls in place that you only have access to what you have or you should have? And if you have access to what you should, are you guaranteeing that the password that you're given is really being used just by you? And I have a password and, well, I'm not feeling well today. Hey, Dustin, can you cover up for me today? And I'll share my credentials with him. And then all of a sudden, it's like somebody got a key to my house and
Right.
off we go.
Right, right. No, I couldn't have said it better myself, Luis. Like, just the amount of different touch points that can have access to the sensitive data is mind blowing in the healthcare system. As you mentioned, there's you can go to the pharmacist, the insurance, the med student, whoever it may be. How are you currently organizing the hierarchy of permissions for each of these different levels, right? And I think it's very easy to forget that a lot of organizations just kind of put blanket policies in place, and they're not looking at individual use cases and changing use cases, as well as what happens when people leave organizations. How quickly are we deactivating these accounts and not letting these orphaned accounts be out there? I think these are all really important factors to realize that, again, yeah, maybe you checked the window to make sure it was locked yesterday, but did you check again today? Right? Did things change overnight? It's not just, you can't just fix it. Well, it's an ongoing process to be able to set a foundation in place that allows you to continuously monitor what's going on with your organization and how with the breadth of your digital infrastructure.
And how easy we make it to people to manage, right? Keeping the analogy of the house and which I love, Yesenia, I think it's very, very applicable, is everybody has their kids, you have your day job, you have all of the tasks, you have all of the things. So if you're making this extremely cumbersome, it's like, oh, I need to go into 5 different places because now I have a one key for the door, one different key for the window, and then there's a different key for the garage door. If I had to go and fumble for like a keychain full of things that I need to remember to go through all of them, chances are that, yeah, I might actually have checked my back door and that's closed, but did I lock the garage door? I can't. Ooh, I think I did. And the think I did, it might be that one case where it's like, ooh, I didn't actually. And
Instruction. So, so many different steps to take, and it's all very cumbersome, but ultimately, like, give me some results, I guess. I don't wanna say, "Give me some horror stories," or kind of give me some examples of, worst case scenario kind of things, but kind of put into perspective because I get it, everybody's busy, they're implementing things as whatever the priority might be for that specific organization. But what are some consequences or risk if these issues do not get addressed? Um, Either Justin or Luis, if you have some examples that you can provide in this. I know I keep seeing every other day there's a different healthcare or a hospital getting sued because of a data breach, and then they have to pay everybody out. So beyond, that, what are some risks that you have been seeing an increase of or things for our viewers to consider?
I'll to put into perspective, right? The latest account, the latest data available shows that 259 million of Americans have got their healthcare data exposed in a data breach as of end of 2024. It's like, it's a huge number, but it's even more impressive when you put that into perspective. That's a little over 76% of the US population, which means that 3 out of 4 people have got their data breached and exposed somehow. Um, so that to put into perspective how big this is, right? Everybody goes to the doctor. You all, like, maybe not everybody, but majority of people will go to the doctor. Will go do multiple visits. So you're exposed to it. So the risk is, how can we make that process easier? The risk of it is your data is available, right? And that costs millions and millions for the organizations. It costs headaches for the patients, and there's a lack of trust in the healthcare system. that the data breach doesn't help make people feel warm and fuzzy with let me go to the doctor, which in turns, right, the more I procrastinate going back to the doctor, the more the higher chance of actually having higher risk of not being treated and not dealing with the disease early on. So from a output base, from a value of the care, I'm creating direct impact. I'm making it harder for the patients to seek the care that they need because people are afraid, or people might be afraid of coming in. So having that data security and looking across and really borrowing from a broader security framework perspective is that, are we doing really that zero knowledge architecture? Like, can I validate anything really without having to capture the data? Can I making sure that I'm isolating, I'm segregating the data, so if there is a breach, that I can minimize that point, and really taking really a lot of effort to go through the different barriers until it gets to the meat of the data storage.
I was just gonna say, I'm like, I think it's so important too, is you just mentioned, like, trust, patients' trust and everything too, is like, anything to deter you possibly going to the doctor in general is not good, but now you have this on top of your data being exposed and everything else, so another factor, but, definitely taking the patients back into consideration and how they trust and, how they work with that organization, but Dustin, please go ahead.
No, I was gonna follow up on the exact same point. I think trust, what Luis, what you mentioned is, it's a huge factor. I mean, we can talk about all the fines, that organizations get and the millions of dollars of loss, but at the end of the day, the biggest loss is if a consumer, a patient, whatever it may be, does not wanna do business with you anymore. That's the end of it. Those are dollars gone away for good. And it's not only the trust with you, but trust with any of your partners or suppliers who work with you, right? So say, a large hospital has a breach and then you find out that heavily was impacted by a pharmaceutical company that also tied data to them, right? Then you may not want to purchase medication from that pharmaceutical company anymore as well. So I think there's a ripple effect beyond just that healthcare organization with whoever they do business with as well, which can again lead to long-term loss of funds and trust from the end user.
Yeah. And heading to it is, it's like the world is inherently digital, right? We all rely on digital tools,
Mhm.
information. And I heard this from a CIO from a hospital recently, related to the big breach last year. Well, a large hospital manager. When there is a breach, you shut down the hospital because
Yeah.
your electronic health records are digital. Well, electronic, right? Your health records
Mhm.
are
Yeah.
digital, they're electronic. But not only that, you don't know where the breach happened or where the way. So you take down your EHR, you're taking down all your protocols, all of the support. So a lot of people coming in, and as you have more new people coming to the workforce, some people, the CEO was saying, is like, we have doctors and nurses that have never charted a patient in paper. So the unspoken side of the breach is not just the data, the patient data itself, but what happens until you can bring a hospital back online. Like, you have nurses, and I was saying nurses and doctors that never charted a patient data in paper, calculations, dosage, things that you don't realize, and they are just spit out automatically because of the system does all the calculations and does a lot of the easy process. That doesn't happen anymore. Now you go back, pen and paper. All right, what is the what is the weight? What is the height?
Yeah.
The doses of
No,
the medication? How do we get to the calculation?
100%. I mean, yeah, that operational efficiency and resiliency that is now very much reliant on your cyber resiliency of your organization. So when one part goes down, when one thing is impacted, how much of your organization is affected. And when you think about identities and third party identities, if you're able to isolate that and understand where a breach may happen, and you can really, turn off or stop something ahead of time, then you don't have to take down the rest of the organization, right? You can stay cyber resilient and then keep your operational efficiency.
Absolutely. Love your point. It's that resilience. I think it's the key word.
Yep.
It's not a matter of if we're going to get a breach. It's a matter of when at this point.
The
So
one. Exactly.
Yeah, I can literally probably continue with this whole all the different ways this conversation can spur out because it's again, there's so many different things to consider that you probably would not have, or you would just again, I would have never I've seen it happen before in the past where I've had a customer had a breach in an organization. Their organization was not only effective in not being able to access the EHR, but then it also threw off all their surgeries for the day. It locked down anything that they had to get those medications because everything is all connected. So while the internet and all the technology and cyber connections and everything are amazing and they're all great for us and the Aura rings and all the new little wearables and everything else. But you don't realize how much data you are, putting out there essentially for people with bad intentions to be able to get access to. And it's a scary aspect of everything nowadays. But Dustin, what's working to mitigate these risks? Like, I mean, we've talked about so many different attacks and different variations of them. But what does a modern defense stack look like? Like, what do people need to kind of consider to help mitigate these risks, or what's top of mind, I guess, to them?
Yeah, well, I guess when it comes specifically to, third party identities, and you mentioned, AI earlier, really, it's helping people get past, the simple password protection or simple multi-factor authentication. So I think what organizations are starting to look at and starting to put into place is more complex risk management, authentication factors on top of their identities as well. So you think of, like I mentioned, liveness detection, like really making sure that you can actually take a selfie and live scan a face, map that to a valid driver's license, passport, looking at behavioral biometrics, right? How quickly does a person type? How do they move their mouse? How does Luis normally hold his phone? He normally holds it like this, but for some reason his phone is, 180 degrees upside down when he's inputting his password right now. So that doesn't sound right. Let's step up and do a different authentication factor. So I think in terms of, you know, the different tools and things you can do to put into place, it's really going beyond what's simple with passwords. And at the end of the day, trying to get rid of passwords, right? Trying to go passwordless uh, for everything when it comes to these third party identities, and making sure that we can reduce that as a factor for attackers to get in.
and if you can pick back on your point there, Dustin, from an app perspective, right? It's separating also the elevator privileges you have, isolating what data will you get access to because you're logging in, and not trying to solve things on the app. It's like, for now, right? Speaking from an engineering perspective, right? We're developing the solution. Yeah, great. Hey, I'll come in, I'll connect to Thales, I'll get the authentication. You go in, put in your password and in your username and password. I'll hit the service, I'll get the token, I'll authenticate, and voila, everything is there. I'm ready. And it's not just that, it's not just the front door, right? It
Right.
cannot be just the front door. So it's looking at the quality of the applications, you're not falling the breach, but also making sure that you had the different roles, you're looking at validating the user, but always authenticating, making sure that you're not giving or leaving the application open for like the session spoofing and different
Right.
techniques that can be used, but also making sure that you're always checking, right? It's critical enough where, yes, depending on what you're doing, what data you're accessing, yeah, you might actually want to do a re-authenticate. Yes, it might be painful. There is a point with the workflow, but you mentioned, and I think it's super critical, the passwordless. Like, yeah,
Mhm.
just put your thumb on there, put your scan, your facial scan, put your badge. Every Either you like it or not, everybody's badged out on the hostel, right? Or yeah,
Right.
you have your finger, just put a fingerprint there. It
Mhm.
that investment, and it is a capital investment at the beginning, but costs a lot less than your data being you being on the front page of the
Right.
news with
Right.
your brain.
And I think your point too, there has to be some level of friction to make sure that you're having the highest level of security, right? There's a balance between seamless and friction, but that little bit up front really helps not only protect you, but the entire organization, and to make sure that you're not having that front page headline of, you know, millions of dollars of fines or tens of millions of identities stolen. And yeah, that I think that's a huge thing where a lot of people think, oh, well, this is just going to be cumbersome, but there's a balance there of how you can really make sure as you mentioned, if they're trying to access certain parts of data, maybe we do a step up authentication, right? They're trying to do a specific part or access, a specific application, then yes, you weigh the risk of which applications have which data and how those users should be accessing that.
Mhm. I think there's an element of, because security has been forgotten so much, and it draws a parallel with the physical security, right? We were just talking about the
Right.
board, the windows, and all of it.
Yeah.
So
Yeah.
you're ultimately, the solution you have is always putting a lock on everything, right? You put your lock there, you lock the door, you lock the window, and that's your security measures. It doesn't work. It's not a one size fits all. So
Yep.
what is the risk? I think you touched on an interesting point, is what are the risks associated with this? It might be that I do need that step up authentication, or hey, no, I don't need to do something up until this point at this step of the journey. Yeah, I don't need it. I'm capturing the data. Great. You're already authenticated. Let me add as much data as you want into the system. Great. We're ingesting it all, taking it out, looking at it, looking at some of the history, whatever that is, then you need that step out, like isolating, not thinking of the strategy as a multi-step, multi-layer, multi-prong approach to the data. And there's no putting the locks on something, otherwise it's going to be very, very cumbersome. So layer it in different aspects of the application, of the data access and all of it, the reporting and all.
So I guess this question can go to both of you, if not either one, but what can organizations do now then? Like what are progressive healthcare organizations, working on to stay ahead of these third-party identity risks, or what steps are they implementing to get ahead of these different risks that might be out there?
From an identity perspective, it's a modern identity platform focused on these external identities, and the way they do that, the way you look at these identities, is how close can I get to the end user, right? It's a platform that allows me to get closer to the end user. So if I'm thinking about, you know, a med student coming in for a rotation, right? Who's admitting and onboarding that med student from the medical school, right? Who is selecting that student to come on board, right? How close can I get to them? Or if I'm looking at temp nurses or specialty doctors, what is the agency or the group associated with those temp nurses or specialty doctors who are allowing them to come into this organization, right? Who's vetting them? And if I can set an admin closer to the end user and really understand when those end users are coming on board, when they're leaving, what information they're going through, as well as setting a cascading hierarchy of permissions and knowing I can grant and revoke permissions. I think that's really the biggest factor when it comes to these external third-party identities, right? How close can I get to them, and can I enforce my permissions, my hierarchy, my policies, and making sure they're adhering to, again, if we're going all passwordless, making sure they're doing biometrics or facial scan. Are they making sure that they have maybe a FIDO device? Do we want to make sure they have a physical device to go on top of what they're getting into? Again, I would say that those would be I would say the nuts and bolts, or the foundation of what you need to start looking at. How can we protect our third party identities from a potential breach?
So you can add to what can be done there. It's really thinking of that strategy, the data governance and access, and implementing that into something that is actively monitoring, right? We can put fences around, but if all I'm building, I'm putting the fence and I'm not monitoring, eventually somebody's going to go around and jump the fence and get out to my data, right? So it's in factoring in the reality, because if you're the sure way of failing of implementing any security policy is making something so hard that people will find ways of circumventing, or people are not going to do it at all. So you have to collect the data. You make it so hard to collect the data, people are going to go and do it on something that's less secure. So that journey, thinking of the user journey, right? The nurse, the physician, the patient, how they're using, how do we make it, we incorporate the technology in a way that it is safe and it is secure, but it's also as frictionless as possible, but without the allowing for anybody to come in becomes the critical part. Like I mentioned, the FIDO devices like tokens, you have security card scans. Everybody, when you think of the journey, right, is physicians have their pajama time. So they are done with the visits, they're done with the consults, they're done with the hospital day, then they're gonna do the charting. Nurses, same thing. They're gonna go for the different times. Many cases, they'll take their laptops, they're gonna work from home. That's another part of vulnerability. Yeah, you can VPN in. Well, what happens if somebody breaches that VPN, that laptop with the VPN? Then you get access to everything. So it's I know this was a big thing, a big topic in the past, and it seems to be coming back now. It's, people can spoof SMS. It's like a lot of people will use the
No.
SMS as second multi-factor authentication. Yeah, other people can come in and spoof your number, and yeah, get the authentication. So depending, again, elevating privileges, what are restricting access, or really having give you access to the least amount of information to query and starting looking at the behaviors. I think where a lot of that is making sure that you're applying the appropriate amount of security and the right amount of friction that allows people to make it hard, that allows people to get their work done without being so disrupted that people will just drop, but we're also not letting just people walk in and out of the door in case like your credentials are stolen, or there's a compound effect of somebody breaches a third party that's a lot less um enforces a lot less enforcing power than like these large organizations. Like back to my analogy at the beginning of the Fort Knox. Like, yeah, the hospitals will tie everything up, but what about the vendor that got access to my hostel? So
Right.
how do I give you the privilege to do your work as a third party? Because I'm paying you to do so. So I want you to be efficient, but I also don't want your lax policies to put me at risk.
Right. No, I 100% agree, Luis, in terms of making sure, yes, they adhere to your policies. And I also love that you brought up um, their multi-factor authentication, like SMS, that are outdated in today's world, right? It's the just because you have a second factor authentication doesn't mean it's the right second factor right now. It's like we need to move towards pass keys and FIDO devices or whatever it may be. And I love that you brought that up because when you think about the modern digital infrastructure of a healthcare organization and all the different points, where is that data going? How is that, is there still legacy systems that are, still trying to access that data? Is that data duplicated in multiple areas? Are we actually having one source of truth, right? And yeah, I love what you brought up there. And this is like, at the end of the day, you have to understand what everyone is trying to get access to, and can you enforce your permissions and roles and audit those trails as everyone goes around.
What questions should CISOs be asking their IT teams, their vendors even, to be able to make sure that they're taking the right steps to prevent these? Like, what are some things for them to consider?
I think the first question is w- how far or how much have we tested and stressed our policies and our practices? Because everybody has a practice. Everybody has something in place. You're not going to find anybody to say, yeah, we're not worried about this, or we don't have a plan, or we don't have a policy doing this. Everybody has a plan. Like Mike Tyson famously said, right? Everybody has a plan until you get punched in the
Until you
face.
get punched.
Exactly.
So, like,
By then, it's too late here, though.
Exactly. So before you get punched in the face, are you practicing? Are you like, do you have your helmet on to take the punch? Are you testing? So I think the number one question is, all right, what are the levels from a CISO perspective, right? And CIO perspective? What are the levels or the different approaches we're taking? What are the different steps? How is this being incorporated across? Are we doing this on a multi-level, or are we doing one solution across the whole enterprise? And then start digging from there into the data. Like, do we have data segregation? Do we have access segregation? How do we ensure what are the points of and having clarity? Like, it's impossible to protect everything, but do I have one critical point of failure that if that one fails, then do I put everything at risk? Do I shut down my hostel essentially?
Mhm. Yeah, I think the biggest point you just said there is where is all my data? You know, where is it all? Where does it all live? And how are people currently getting access to it? There the countless number of times, and I'm sure you've seen this as well, Luis, the same amount of data is duplicated in multiple different applications, wherever it may be, and it's not being secured the same way, right? And so you access one application that no one's really thinking about too often, and then boom, you have all the data that you needed. So yeah, go ahead.
I was gonna say even some silly examples, and this happened just this past week with me. I was taking my son to the doctor, and his follow up has an injury from a year or so back, or 2 years actually at this point. And the doctor wanted to see like the history of like all of the imaging and all of the x-rays and all of the stuff that he has had done so far, taken, and conversations. I asked for the all of the history. So I brought all of the imaging that I had that I could retrieve from the different doctors and different visits. And the nurse was like, yeah, all right, great. Thank you for bringing this over. I'm going to load this into the system. Bought the CD right on the computer in the office, and loaded the scans or the images into the EHR. Nothing like no worries, no concerns, no nothing about what could have been on that disk.
Right.
Not if I was very like a very bad intentioned person. Then what?
Right. Mhm.
Right, the zero trust policy is so important.
Yeah.
So, gentlemen, this is I was about to say, I'm like, go ahead, go ahead, Luis.
I was just gonna say this was actually a realization that I never thought, because this is not the first time, but it was the first time that I saw this CIO speaking after the one of the big breaches that happened last year, and the hostel that got breached, or one of the hostels that got breached, was like a couple blocks away from his hostel, and he was saying he was raising some of those points, and he was the one that mentioned about the protocols. It's like the hostel that got breached called them. It's like, hey, can you share your protocols for ICU, for NICU, because everything we have is offline now, and we need to get people to make sure that they're following the right steps. And it dawned on him as like, of course, yeah, I'll share. Like, don't want to put any patient at risk. And then all of a sudden, it's like, well, how do I share this? And all of the patients getting diverted or transferred from that hostel that was breached, that was shut down, getting sent over, and they were like getting CDs and things that were being processed locally so that they can transfer the patient as quickly as possible. And he's like, well, I don't trust. So how do I set up this in a way where I isolate my entire infrastructure? I was like, this is like a mini independent infrastructure here that I have to spin up as quickly as I can to intake these patients as efficiently as I can, but also without jeopardizing my operations. Because I don't know how they got infected. They have no idea. Might be a virus, might be whatever it happens, like start trickling down to the point of the ransomware. And how do I then isolate this, but I still can ingest the data? So that's zero trust policies. Like, how do I do this? How do I exchange data and make sure that I'm not putting myself at risk? It's some just some insights, like, and it never occurred to me. It's like, yeah, it's like I might be as well intentioned, and I'm just there for the care of my son, but it's a lot of people that will go for a lot more trouble than just going and scheduling an appointment and putting everybody as a vector in, right?
Yeah, I think that's why it's so important to have proper audit trails and consent and understanding you're tracking who's getting in and when. So like we've talked about that cyber resilience affecting operational resilience, if we can pinpoint the exact location of the breach and what happened sooner than later and not having to take down everything, then maybe in the next scenario like that, that next hospital can trust that, you know, part of that data coming in is actually secure and safe without, everything being breached.
Yeah.
Well, I would clearly, we can go on all day about this. Like, we have so many more topics to cover. I'm sure there will be a part 2 to this. But is there any closing remarks then maybe that you would like to add, gentlemen? Whether it be an action item or a step that they can our audience can take now to make sure their organization is more secure?
Let's say, don't, uh, don't 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 shy away from asking for help, right? People are dealing with this day in and day out. We're seeing different things being done. So looking and look for like the specialist. What we're doing with a lot of clients is looking at their application, the security of the application layer, making sure that they have the data segregation, data access, the governance, the policies on the data on the application side. This is what we do at CI&T. This is some of the services we can provide, and then bringing like somebody like Thales that knows the access, how the management, the proactive and active monitoring the security. That's that's who can come in and have a much better understanding of how to better protect that access. So bring people, bring the specialists. It's not a topic where you can kind of finagle and do it on your own. It's like you can until to a certain point. It gets to a point where you really need to be thinking at this more serious.
Yeah, I agree, and I think make sure you're looking at it holistically, right? Like your entire operation. That's where CI&T has been amazing in terms of overall architecture modernization of your organization's infrastructure, right? And that's where we love working together. Is we can come in from the Thales side, from the identity side, and really help you look at all different parts of your identity, right? Not just third party, but let's look at your end user. Let's look at your workforce. Look at how everybody is accessing device identities, machine identities. How is every point of contact in? And then having somebody like CI&T really take a look at everything, including your security layer. How are all these applications functioning together? How is all of this data flowing outside of just identities? And can we take a holistic approach at it? And I think when you bring in two titans in the field like that together, you can't go wrong.
Well, thank you so much, gentlemen. This was great. We have so much to consider now. I'm pretty sure we'll probably need a part 2 to go to this, but thank you so much for joining us, Dustin. I really appreciate it. Love this partnership that we have with you guys over at Thales. So thank you so much. And Luis, as always, thank you for joining us. And thank you to the audience. We will see you guys next webinar. Bye.
Fine. Take care, guys.
Thank you so much, everybody.